So when we talk about brain tumor, it is a mass lesion or an intracranial space occupying lesion which lies within the skull. So we know that skull is made up of bone, which is a tight compartment, and within it lies the brain, which is surrounded by meninges, and there is also fluid and blood vessels. So any tumor which is arising either from the brain parenchyma or arising from the covering, that is the meninges, or various parts of the brain like within the ventricles, within the pituitary gland, can be a brain tumor. It is abnormal growth of cells which can be either tumorous, non-cancerous, or it can be a cancer. When you talk about causes of brain tumor, per se there is no specific cause for having a brain tumor. So brain tumor can be of two types. One is that is primarily originating from the brain, or the tumors which are coming secondary from the any other part of the body. So the secondaries can be coming from any part of the body like breast, like lungs, like prostate, or any other part of the body. But the primary tumors, less than 1% can be associated with some syndrome or some genetic factors. Otherwise 99% of the primary brain tumors, they occur de novo, and there is no specific reason behind their occurrence. So when we talk about symptoms of brain tumor basically it presents with headache which is usually in the early morning. There is vomiting which may relieve the headache. The headache is continuous, dull aching type and progressive. It progresses over the days. There can be seizure or commonly known as fits, or there can be loss of vision, loss of hearing, loss of smell. Some people may become sleepy, drowsy, there is a change in personality, or some patients become unconscious before they present to the doctor. Any brain tumor suspicion with the symptoms of headache, vomiting, seizures, limb weakness, unconsciousness, drowsiness require MRI of the brain. So MRI of the brain is the best investigation which gives maximum information about brain tumor. Once the brain MRI is done and we are able to diagnose a brain tumor, then we have to visit a neurosurgeon who will decide the treatment. In 99% of the cases, brain tumor requires a biopsy, because we have to decide what treatment has to be given based on the histopathological diagnosis of the tumor. It can be a primary brain tumor, it can be a secondary, as I told you, metastasis, or it can be tumor of the hormones, or it can be a benign tumor which doesn't require too much of treatment. So surgery is most important, which removes the tumor, reduces its mass effect within the brain, and also it gives us a biopsy so that further treatment and prognosis can be decided. So apart from surgery, we have other options like radiotherapy, chemotherapy, like we have heard about radiosurgery, gamma knife or cyber knife. So certain benign tumors are amenable to these type of therapies as well. Otherwise, primarily surgery followed by, if required, radiotherapy and chemotherapy. So when we talk about brain tumor, since we do not know the cause, so there is less chance that we can prevent it. But definitely early diagnosis of the tumor when it is in the early stage, when it is small in size, will help us to treat it in a better way or sometimes even cure it. So with the slightest of symptoms, person should not refrain from going to a neurosurgeon, getting his MRI done, so that this tumor is detected at an early stage and it can be treated well by surgery, by radiotherapy, chemotherapy, immunotherapy, or other modalities which are available with the doctors. With modern technology and modern techniques, the brain surgery is becoming safer day by day. I must tell you that brain tumor surgery has become so safe that now we say that the complication rate is less than 5%. Over the years, the maximum technological advantage and advances have been made in brain tumor surgery with new gadgets and technology. So brain surgery has become safe because of better diagnostic modalities like good quality MRI and its newer sequences. Neuroanesthetists also play an important role in successful brain surgery. They help us to operate in a normal, lax brain. Apart from that, new gadgets like good quality operating microscope, CUSA machines, fluorescence technique in microscope, neuronavigation, neuromonitoring systems, good quality cautery and suction machines, plus internet giving us the idea of the new technology and techniques which are going across the globe. has made brain surgery safer, and we are able to pass on the benefits to the patients. Yes, if you have somebody known to you who has brain tumor, please recommend surgery. I hope he will get cured with a good treatment at a good hospital.